absolute pleasure to welcome you all to the House of Commons today and to host AMMF's reception. And I'm very pleased to welcome you all here as we announce and embark on something really quite special, which is to draw attention to one of the main types of primary liver cancer, cholangiocarcinoma.
Back in 2018, AMMF commissioned and funded a first-of-its-kind cholangiocarcinoma data project, and the findings from this project are white paper, available here today, which includes a series of evidence-based recommendations we hope will reach those who have the power, the influence, and the will to change policy.
The incidence, the number of new cases of cholangiocarcinoma is going up and up and up, which is an indicator that it's a pretty fatal disease. Even if surgery is not an immediate option, getting the patient to a specialist centre for specialist care is really important to have that opinion, see if anything can be done. So it's crucial that every person diagnosed with cholangiocarcinoma has their case reviewed by an appropriate specialist multidisciplinary team.
AMMF and Helen have done a fantastic job with the white paper, so to get that data out is a brilliant piece of work, and we'd like to thank them for it.
We've got the targets to say in 2028 75% of all cancers will be treated, etc. So hopefully AMMF can change policies. I was diagnosed with cholangiocarcinoma last year, so December 2022. I'm also in the medical profession myself, so things I can take back to the hospital to learn from, also share my personal stories from the patient side as well.
They've had people here from NHS England Cancer Programme, they've had MPs here, and I'm really impressed today with the quality and quantity of people who are here. I think events like this bring the focus together, notice that there's something significant going on, and I think that's all been delivered today by the charity.
Events like today help us contextualise that impact that this has on their patients and their families, and I hope that there's more that we can do to help collaborate in the future to improve the outcomes for these patients.
There's clearly a lot to be done in terms of education and just trying to get cholangiocarcinoma properly recognised and treated.
Some of the patient messages were really powerful, and I think it often starts with that. The geographical variation we see in the way these patients present, the way they're diagnosed. We know that actually often a successful way to treat cancers is getting very well established pathways, which is obviously really important in trying to change policies and try to change the way we deliver services to these patients.
I'm incredibly grateful for all the medical practitioners that have meant that I'm still alive today when I should have died 4 years ago.
The fact that they had to see a second opinion to get treatment was quite sort of striking. I just assume that everyone is referred to the specialist.
The point around inequitable treatment was incredibly sad and appalling. They illustrate how important the work that the charity is doing and how much we as a wider health system need to do to try and help and support.
It's not an ultra-rare disease. It's a disease which, according to the data which has been presented today as well, is rising, and it deserves, a place recognized by the society, so that patients deserve the right treatment and the optimal treatment in the UK.
Having read all of the white paper, talking to a number of people in the room, it's actually given me a lot of hope, because without a charity like this, we wouldn't be able to help drive change.
We need to address the lack of awareness that exists, not just within the public, but within our policy makers and within our professional colleagues. And this call to action sits very squarely with the UK government's aim of seeing 3 out of 4 cancers detected by early stage by the end of this decade.